more than half of Ontario hospitals operating in the red. A funding crisis may be harming patients in need of care, according to this report by the Canadian Centre for Policy Alternatives, which suggests wait times in emergency departments are increasing. It highlights costs in the hospital sector have been growing by 6% per year due to population growth, aging, and inflation, but that the Ontario budget plans to increase healthcare funding by 3.5%, impacting wait times, with 90% of patients having spent 44 hours in the ED awaiting admission, a 52% increase over 5 years.
The issue is that there is just not enough funding all around. And it's uneven in terms of the impact based on the size of hospital and their capacity to sustain multiple years of deficit.
The report's author says long wait times and overcrowding are indicators of a system under strain, and it comes down to
inadequate funding all around,
with smaller rural hospitals hardest hit. But the health minister points out big investments are being made, and hospitals have been tasked with balancing their budgets in 3 years.
Hospitals are being asked to look at the long-term future and say, what is your plan for your individual hospital corporation to make sure that the money that is being funneled through to your operating dollars, again, 4%, for a fourth historic year in a row, is actually going to be spent on frontline patient care.
The Ontario Council of Hospital Unions is calling on the province to take a second look at the issue.
What we're looking at down the road here is an intensification of the cuts. We're looking at ongoing access problems and a degradation in the quality of care.
The report recommends a workforce strategy to address staffing shortages and a long-term hospital capital plan. Caryn Lieberman, Global News.